Hello and welcome to today's show. I'm Jamie Smith, Cancer Control Specialist with the Kentucky Cancer Program. Today I'm joined by Missy Hollis, and she's with the Kentucky Pink Connection. And this is a new, unique program to the state of Kentucky, and we're very excited to have her here today and learn more about this program. It's going to be able to help those people that are diagnosed with breast cancer and also women that are interested in finding ways to help with their cancer prevention screenings. So Missy's here to talk with us today. And first of all, I just want her to kind of start off, if you wouldn't mind, Missy, just tell us a little bit about yourself and how you actually became involved with the Kentucky Pink Connection.
Okay, I am an 8.5-year survivor. I was, I guess during my journey, I met the executive director of Kentucky Pink Connection. Her name is Vicki Blevins, and she owned a mastectomy boutique, and that is where I purchased my wig and those sorts of things. So I got to know Vicki a little bit, and then I became involved with Susan G. Komen's Race for the Cure, and Vicki was the race director that year. So for almost 9 years now, we've kind of stayed in contact with each other, and in spring of 2009, I had, my job was eliminated. And so to stay busy, I started volunteering for Vicki, and that grew into an opportunity, along with a grant from the Breast Cancer Research and Education Trust Fund to be able to come out here to Western Kentucky and introduce ourselves and kind of get the word out.
Okay. And if people don't know what that trust fund is all about, it's the breast cancer license plates that you see many people have on their cars today, and money from that goes into that education and trust fund. And we
apply for a grant every year, and it's basically really not as much for patient services as much as it really is to educate people on the need for screenings and how to go about getting screenings if you're underinsured or uninsured.
Great, because there's so many women out there that maybe have a little bit of fears, and so for us to be able to educate them on the importance of screening surely makes a difference.
Absolutely.
If we could just talk a little bit about then what the Kentucky Pink Connection is really all about, if you could just kind of explain the mission and the goal of that organization.
Our mission is really to provide as much support as we can to reduce or eliminate barriers, like you were saying, for women who are trying to get screened or who have unfortunately had a diagnosis and are going through treatment. So we try to provide education and awareness through health fairs and other avenues like our conversation today. We do have a goal at Kentucky Pink Connection that we would like to take all of our breast cancer services statewide and eventually be able to offer services like this for women with any breast or gynecological cancers or problems that they may have.
That would certainly be a great day in the history of Kentucky if that were to ever happen, definitely. Where is the office for the Kentucky Pink Connection located?
Kentucky Pink Connection is located in Lexington. The address is 2417 Regency Road, Suite C. And for anyone who is familiar with Lexington, it's right off of Nicholasville Road.
Okay, that's a very popular road, especially if you like to go shopping.
Very.
Now, you said you talked about the executive director, Vicki, and so she kind of course, had a dream of what the Kentucky Pink Connection would be. So tell a little bit about how it was actually founded.
Yeah, you know, Vicki saw this even when she had her mastectomy boutique. You know, she really saw where women who are underinsured or uninsured really struggle with those things. You know, Medicare and other insurances will help you with your treatment, but you know, no wig or a bra that fits correctly, those kinds of things are often not covered. Right. So she has always seen a need to help those women. So in 2008, she just started this whole Kentucky Pink Connection out of her home, and she just saw that underserved women just face way too many barriers, and they just can't get over those barriers or eliminate them in any way, so a lot of times they just go without, you know. And then it's a more advanced disease and takes more time, more money, that kind of thing. So she worked out of her home, and she navigated about 160 women in her first year. And in her second year, she hired a part-time woman to work, and she had a few volunteers, and they navigated about 450 women. And this is her third year. We are about halfway through our grant year. We were partnered with the Lexington-Fayette County Health Department and budgeted to serve 600 women. To date, we are just over 500 already, and we still have 6 more months to go. And then along with the Kentucky Breast Cancer Research and Education Trust Fund dollars, that grant allows us to come out to the other remaining 62 counties, and we're budgeting to reach out and try to educate at least 500 women in this area.
That's a great number. And one thing I know too that we find often with the Kentucky Cancer Program is people call us for resources. You know, they need help. Maybe it is with payments and things like that. So of course now we're very eager to be able to, you know, give them your phone number. But one thing you've mentioned about Vicki, you know, starting in our house, and it's still very low operating cost that Vicki uses in the office. You know, she's got You Now, which was just recently added, and then she has another part-time. So I mean, she's very frugal with her money on the administrative side.
Yeah, and we also have been able to work with some women that are going through vocational rehabilitation, and they come over and do a lot of data entry for us and answer phones and you know, do some mailings and that kind of thing. Vicki was very impressed with a program out of Harlem, New York, and it was Dr. Harold P. Freeman's navigating program, and it dealt with 3 areas: the outreach and the education, and of course the navigation during treatment, diagnosis and treatment, and then the whole rehabilitation piece that comes after that. You know, when you're a survivor, and what we have found is a lot of women who are surviving, that's their give back period.
Right.
And that's when they want to do fundraisers, or they come in and volunteer for us, you know, that kind of thing. So we're just one big happy family.
Right. It's neat. It's so neat to hear Vicki talk too about her experience that she had up there. And she mentioned one time she was walking around Central Park, and the volunteers and the workers there at the clinic that she was shadowing, they would wear signs through Central Park that said, you know, need a cancer screening or something. And so she has some great ideas to bring back here to Kentucky, and you know, just the small amount of time really that she's had to get this program up and running, she's made a dramatic change and a dramatic impact on Kentucky.
She's touched a lot of women. I can't begin to tell you how many women she has touched. And you know, it's amazing just to even go out with her in Lexington. And so many people know her, and they're so grateful and so thankful. And we've got a little board where people send us thank you cards and pictures. And you know, I mean, you know, they'll have reconstructive surgery, and then they'll put on a T-shirt, and then they're like, look, you know, and they're so fun, you know. And there is the other side of it where someone didn't survive, and their families will donate, you know, gently used a wig or bras or nighties or, you know, something along those lines to help out. So, you know, Vicki has made a name for herself by giving so much of herself and her time to battle this disease. So there are quite a few people out there. I don't know that she even knows all of them that are willing to help her to do whatever we can to reach out to everybody. You know, we can't just stay in one part of the state. We need to reach out to everybody.
Right, and we're certainly excited you came down to this area to...
My first time.
Yeah. We've talked a little bit about how the Kentucky Pink Connection is funded, obviously through a Coleman grant for the Lexington affiliate out of the Coleman office, but also now the Education Trust Fund that we've talked about. But what other ways do you all perhaps get some money?
Well, to talk about the affiliate for 1 second, you know, the Lexington affiliate of Susan G. Komen for the Cure is accountable for 58 counties in the state. So it's basically from Lexington east and south. And then we have our remaining 62 counties that we're also trying to touch. as I'd mentioned before, you know, women who are in the rehabilitation part of their journey want to give back. So we do a lot of fundraisers, or they do a lot of fundraisers for us. And because our affiliate is out there for 58 counties, if there's a woman outside of Fayette County that does a fundraiser, and I'll just pick a county, I'll say McCracken County. If there's a fundraiser that's done in McCracken County, those dollars are restricted strictly for McCracken County. We don't take that money and spread it across. We want to save that money, and for women in this county who need a mammogram or don't know what to do or need help with prescriptions relative to breast cancer, that kind of thing, that's what those monies are earmarked for.
And I think that's remarkable that, you know, you all do that, because I know many women want to be able to help other women in the county, you know, so for them to be able to do something like that would make a huge impact.
Yeah, our treasurer and CPA have a challenge to keep track of all these little dollars everywhere, but you know, but it works, and and that's what's important. It's the women in this county who are raising money for women in this county that need help. So it's up to us then to make sure that that's where that money comes back to.
That's great. That's great. Any other partnerships that you all have that you're able to utilize and network with?
Yeah, we work well with the American Cancer Society. We've worked with the Kentucky Cancer Program. We support groups like Friend for Life, and there's a big support group in Lexington called the Thursday Group. So when people really need support, we'll get them connected with a support group that's appropriate for them. You know, women also call us to say, you know, I'm struggling with food. I haven't worked. You know, yeah, you know, you're having chemotherapy and you're having trouble getting yourself to work. So we will help them get to the United Way or Community Action, God's Pantry. And we also in Fayette County have a place called Christ Community Cupboard, which is a place where you can go to get cleaning supplies and paper products like paper towels and things of that nature, and shampoo, you know, things like that. Whereas God's Pantry, then you can go over and get food. So we'll help them with that. We'll help them get connected to nonprofits that can help them manage credit card debt, or we can help them, you know, work with the utility companies to pay their electric bill. You know, with such an incredibly hot summer we've had, there's a lot of people that are struggling with that as they're fighting through this disease. And of course, the last thing you want is to be doing chemotherapy and not having any air conditioning when it's 96 outside. So, we, you know, we work with them. We don't necessarily, we can't. The monies that we have are for patient services, so we have to rely on other resources. But we do that legwork for these people, so that way we can. All we have to do is to ask them to get a pen, give them the phone number, and explain what they need to be able to tell the people that they're calling. So.
And sometimes just that reassuring voice on the other end, a hand to hold while they're going through all this, because it can be so overwhelming when you're going through treatment, you've received your diagnosis, and so having somebody that's showing them compassion on the other end of the line makes a big difference.
Sometimes you listen more than you talk. You know, they'll call, they have to tell you about their day, and they had their port put in, or they had their chemotherapy for the first time, or they got their wig today, or they shaved their head today, you know. So, and these are huge things in their lives. And so you listen, you know, and sometimes we laugh and sometimes we cry, and, you know, we just do what we have to do so these women have an ear. And have somebody that there's something calming there, because when you hear that diagnosis, and I know this from personal experience, that's all you hear. You don't hear anything else, you know, and then when you walk away and you're trying to relive the conversation, it's just, it's just too fuzzy, you know, everything is just too fuzzy. So it's nice that they do have a place to call, and we know that they'll call, and we know who's going to call and want to chat for a while, and we make sure we have the time and make the time to do that.
So the Kentucky Pink Connection is based off of patient navigation, and some people out there may hear patient navigation and not really understand exactly what that is. And I know that we've talked a little about the steps that you take with each patient, but if you could kind of just elaborate on what actually the navigation is really all about.
You know, by definition, it's really just a system for helping people overcoming obstacles, whatever those obstacles may be. At Kentucky Pink Connection, you know, we don't just get them in for screening. And if we get them in for screening, they go get their mammogram and everything's fine, great, we'll see you in a year, or we'll talk to you in a year. If, unfortunately, there's a diagnosis or there's something suspicious and they need to come back in 6 months, we earmark those people and we follow up with them. And and if they're going through treatment, we'll call them. How you doing today? What's going on? You know, or especially if there's been some bad weather. Okay. You know, do you have power? Do you know, I mean, and obviously they do if you're talking to them, but, you know, hopefully. But, you know, you just check up on these people. And so you're navigating them all the way through from the fact that you have a diagnosis and now your next step, what is your next step? Okay, you're going to get a treatment plan. Okay. While you're in chemotherapy, you know, call us back if there are drugs that they want to prescribe and you need some help with those. And then we'll go out to the internet and see what we can do to get reduced costs for them. So we'll navigate them from start to finish. And then they'll have explanation of benefit forms from their insurance company. Okay. We'll help them interpret those, help them understand that, yes, out of this mound of paperwork at the end of the day, this is what you owe the hospital, right. This is what you owe the doctors. So we just kind of help them, you know, through that. It's just one big maze, you know, made up of a bunch of little mazes. You know, you've got the financial piece of it, you've got the hospitals, you've got the doctors, you've got treatment, you've got medications. So it just helps them from start to finish. And it's nice to see when they say thank you very much and, you know, we're on our way and they're all better and they're back to life and things are normal. So yeah, that's the end in mind.
You've talked about some of the barriers that women might encounter when they're not only trying to find their screenings, but also some of the barriers that they encounter while they're going through treatment. And so let's talk a little bit about some of those barriers and then what Kentucky Pink Connection, sorry.
That's okay.
Kentucky Pink Connection can do with those barriers.
Well, you know, when you're going through treatment, you know, there is the whole medical side of it that we've talked about. And of course, there's the insurance side that we've talked about. There is also the emotional side that we talked about, you know, to help a lady feel better, look better, you know, feel good about herself, because that way then they'll have more of a tendency to want to get out of the house. They'll have more of a tendency to want to go back to work and kind of get on with their lives. Right. So we'll help them with breast forms and mastectomy bras, and of course when you're going through treatment, sometimes you get lymphedema, where you get a swelling in your arm. We will help them get a hold of those supplies. We will help them with wigs, that kind of thing. And with the Lexington affiliate of Susan G. Komen, being with those 58 counties, a lot of these women travel great distances. And when you're doing radiation 5 days a week for 6 or 7 weeks, and you're driving 150 miles round trip, you know, 35 times, that can takes a chunk out of your budget sometimes. Definitely. So we will help with gas cards and eliminate that. We will help with child care if they need it. We will, some women will opt to come and stay at the Hope Lodge in Lexington. So they'll stay during the week, and they'll actually transport them back and forth to treatment. Right. And then they have a place to stay, and then a family member will come and pick them up at the end of the week. So we'll help them with that. We'll help them, like I said, with, say, medications. There are websites out there. The internet, we love the internet because you could do so much research.
What did we ever do before we had the internet?
What we did before then, I don't know. But you can go out there and you can go to websites and put in the drug you're trying to get aid for. Okay. And a lot of times then the manufacturers, the pharmaceutical companies, will come back with applications that you can fill out for these people and get a reduced cost or get their drug for free. Okay. We actually had a young lady with breast cancer, had 2 young children, I think 2, and there is a drug out there, and it had metastasized. But there's a drug out there, and I can't tell you the name of it, but there's a drug out there that is taken, I believe, intravenously once a month, and it helps prevent that spread of cancer. Her insurance company could not could not help us with that drug. When we went to the pharmaceutical company, for whatever the reason, in that particular instance, they could not help her either. The doctor used all of his free samples that he had for her, and then they did a scan. And not only had it had not spread any further, but what was there started to shrink.
Oh, that's always good news.
So we knew it was working. We could not find anybody, and this drug was $2,800 a month. So we were trying desperately to find this woman some help with this drug. Well, we wrote to a local church, and their charity ministry read her letter, and since last November has been supplying her with her drug. And her cancer continues to shrink. She gets no new spots. Every so often she goes in for her scans, no new spots, and things shrink. So, you know, it was just that's just one of the ways that we try to help people, you know.
You're just not afraid to ask anybody, are you?
No, no, we call everybody. You know, it's just sometimes we don't know if caller ID is a good thing or not. But we, but I, you know, and I say that jokingly, but you know, rarely does anybody ever say, "I'm sorry, we can't help you."
Right.
You know, we get. It's amazing how many people out there will say, "Well, my aunt had breast cancer," or "My sister had breast cancer," or whatever. You know, send her over here. I'll put new tires on her car for her so she can drive back and forth for her treatments.
Right.
You know, so it's just a matter of picking up the phone and doing some research. And like I said, the internet is a wonderful thing for that part too.
What about a lady maybe that doesn't have any income, I mean, can't even begin to go get those screenings done? What advice would you give her as she's starting out? Well,
the number one advice I would give her would be don't give up on going to get your screenings, because there is more than one way to get that done. One way is obviously Kentucky Pink Connection, and coming through us, we will help them set up. We do have to do an intake, you know, basically sit down and take some information, demographic information, you know, economic statistics, that kind of thing. And then from there, we'll get them into the Kentucky Women's Cancer Screening Program, which is through the health departments. And then unfortunately, if they get diagnosed, then they roll over to the breast and cervical treatment programs. There is that opportunity.
And then they're covered under Kentucky Medicaid.
Yes, and then they're covered under Kentucky Medicaid then when in both of those programs. You know, there are health fairs where you can go get screenings done. There is different organizations that will bring in a mobile mammography unit, and you can go there and get things done. It's, you know, when you're listening to your television or to your radio, there are, you know, some of those ads that you kind of block out. Some of those ads have, you know, information there for you to be able to go get a free screening. For example, I know in Lexington in September we have a mammography unit coming, and we're organizing some, you know, and it was actually a massage therapy place. It was like a medical spa kind of a place, and they wanted to, they were doing some type of a health fair, if you were. It wasn't necessarily a fundraiser, but it was, and I don't know that I would actually even call it a health fair, but they're actually bringing a mammography van there, and so we're coordinating with medical students and you know, that need to do, there are certain hours I guess they have to fulfill in doing volunteer work and that kind of thing, so we're coordinating to be able to go to different areas around the city and bring everybody there, you know, as opposed to just saying, hey, it's there, try to get yourself there. So we're even offering rides and
so maybe there's some more around the state too that we could.
Yeah, I would think so. I would think, because actually this van is coming out of, this van is actually coming from Louisville over to Lexington, and I know there is a mammography van down from, I guess it would be the University of Tennessee down in Knoxville, and it will come in, it comes into Kentucky once in a while.
So there's areas probably.
So there's a lot of them out there that, and a lot of different ways to get some screenings, but just don't not get them. And of course you can't rule out self-exams either. You know, those are very, very important for no other reason than to learn to know what your breast tissue feels like. So when there is a change, then you recognize it, then you can go and get it checked out.
Right, be sure to report that to a physician. Are there any limitations then that women, if they were to come to the Kentucky Pink Connection, on limitations, like a limit where you just say, okay, we can't do any more for you, we've given you this much money, you're done, or anything like that?
No, we're there and we'll help everybody as long as the funds are there. Okay. So we, you know, we try to get as much funds out of the Komen Foundation as we can, and you know, so as long as we have funding, then we will help.
And the need is there.
And the need is there, then we will definitely help anybody that has that need.
Just real briefly, can you give one or two examples of some of the women that you've helped maybe getting breast cancer treatment, how you actually help them receive the treatment?
Well, there are women that, like I said, fall right into those programs through Kentucky Medicaid, and they slide right through, and everything is fine. Those are the easy ones. But there are women that do kind of slip through the cracks a little bit. Like I said, they will go to the physician that they have been comfortable with all of their lives, and they are diagnosed, and now they can't enroll in those programs. So now we have to get creative. Okay. And if we can help them in any way, shape, or form, we will. But a lot of it, sometimes Vicki will sit down and do some negotiating with the hospitals and the doctors to drop their bills, you know, and drop their costs a little bit, and say, you know, will you accept this if we pay within a certain amount of time, you know, those kinds of things. There are negotiations that can be made on behalf of these women who are very likely, in some cases, to say, I can't afford this, so I'm not going to do it. Right. You know, that's where we're like, wait a minute, you know, let's get creative here and see what we can do to help you.
So the women definitely then can just pick up the phone and call you and see what kind of avenues maybe are available for them. And how can a person actually reach you all?
Well, you can reach us. There is a, let's see, our regular phone number is 859-309-1700. Our website is www.ky, not the entire word Kentucky, but kypinkconnection.com, all one word. There is a form on that website, or a link, I should say, that says, how can we help you? And if you click that, then it'll ask you for your name and your phone number, you know, contact information, and then just a brief description of what you might need. We also are on Facebook as well. So, and most health departments anymore would also have our phone number. Okay. So, and we're available, you know, Monday through Friday, you know, and like I said, there's not a whole lot of us in the office, so sometimes you do have to leave a message, but we do call everybody back, take the intake information and figure out what it is that you need, and then if you are outside of the box, so to speak, where you don't, you know, where it's not the easy slide through the programs, then we get creative and start talking to some people and see what we can figure out to help.
Okay. Are there any final words or thoughts that you want to let the viewers know before we close?
You know, just to stress the importance of mammograms, actually to stress the importance of any health screenings. You know, it is so important to prevent and to maintain your overall health. As you know, and I'm sure you've said this a million times, the earlier you catch something, sometimes the easier it is to get it taken care of. It's definitely quicker and should be a little bit less expensive for you to do that.
Right. Well, we appreciate you being with us today, Missy, and we've certainly learned a lot about the Kentucky Pink Connection and what services are available to Kentucky residents. And if you have a question about today's show, please feel free to call our office at 442-1310. Thanks for joining us today.